this computer. Now I am. So what I was saying, I'm gonna start preparing you for the test. For the past few weeks, it was basic, converting milligrams to kilograms. Actually, no, that did not make sense. Milligrams to grams, kilograms to pounds, basic stuff that you've had. And now we're about to get into the nitty-gritty of it, of actually calculating some medications. How many pills do I need to know? How much stuff do I need to inject my patient? This is what you see on the screen there. This is something you're gonna need to know, not just for testing purposes, and also as a nurse, because you will be doing this. And look at my screen up there. Pros and cons of being a nurse: good pay, job security, great work-life balance, because we only work 3 days a week. Okay, unless you want to work extra, which overtime plus the bonuses they're giving you right now, it ranges from 500 up to 1,000 for an extra shift, because hospitals are busy. Unlimited opportunities. You can work the cancer center, lung center, in the ICU, ER. You can be a nurse practitioner. You can be a teacher, CEO, CNO, direct. Too many to mention. One of my favorite is a frontliner discount. I go to Under Armour all the time, and they give me a discount. Sometimes I don't have my badge with me. I just show them a picture of myself with a lab jacket on, and they give it to me. And also Nursing Week in hospitals is a big deal, because we are the backbone of the hospital. You get free food, you get free, I don't know, a bunch of stuff. Wear comfy pajamas to work. The best part is when people ask me what I do, I save lives. It's what I do for a living. I save lives. And that has a personal, for me, satisfaction. Cons. I don't want to pop your bubble yet, but it's going to be hard work for you guys, especially in the beginning. But once you get the hang of it, about a year in, it's smooth sailing from there. Next. All right, let's do this. Oh, I have these three lovely ladies. They are my students from last semester. I told them I was going to include them in on the list. They just graduated last semester, so now they're working as a nurse. They passed their NCLEX, and now they're going to be, one's going to be in a Valley ER, Spring Valley ER, and one is in a neurosurgical unit. Next. There we go. Let's do this. Parenteral medications. We talk about PO medications by mouth, per rectal, per sublingual, other kinds of routes for the medication administration. But now let's talk about parenteral medications. What is it? It's oh, I kind of did it's these. Anything that's IV, anything, for the most part, anything that I have to put in a syringe to inject you. Sub-Q, intradermal is one of them. Sub-Q, IM, IV piggyback, IV push. I have to do this to you. For the most part, it's called parenteral medications. For the most part, if it's in a syringe, it's a parenteral medication, but then there's also exemptions to that generalized rule, and we'll get to that. So why do we need to use these medications? Because sometimes, indications for them, sometimes you have, a lot of times you have patients that are unable to take, spell check, unable to take oral medications for whatever reason it might be. They can't, maybe they're having surgery, they're in what we call MPO. They had a stroke, so their swallowing doesn't work. And also there's some medications that requires rapid absorption, and it needs to be injected into a person. You'll get to most of these medications when you get to the pharmacology 1, 2, and critical care. And also there's some medications that if we give it orally, it will destroy the drug. It will, by the time it gets to the systemic part of your body, it's ineffective. So we inject these medications. Few of these medications are your CPR drugs, ACLS, epinephrine, norepinephrine, atropine. We'll get to that soon. And when we are doing this, this is an aseptic technique, not sterile. I'm not sure if you've gone through I don't think you have gone through your checkoffs yet. So when you do your checkoff for medication administration, this is not one of those sterile techniques. Aseptic or clean. Let me talk about some delivery method. Syringes. They come different sizes. I know some of you guys have seen these syringes. Some of you guys are techs, CNAs. You work in a hospital, you work in a clinic, you're familiar with these syringes. But for the majority of you are not. You probably have seen these in your in a doctor's office, clinic, or maybe when you were hospitalized or somebody was hospitalized. So I'm going to give you tell you all about them. There's different sizes from 1 cc's to 5, 20, 35, 60 on up. As a nurse, you get to decide which syringes you need to use for your patient. And a generic size of these will be the 10 ml flushes that when you get to your clinical setting, you're going to see them in nurses' pockets, they're in their side pocket, back pocket, and they're on the computers, which they're not supposed to be, but it's a generic size, the 10 mLs. We can use it for anything. Next, let's talk about needles. There's different types of needles. The parts of the needles are different ways to describe a needle: gauge and the length. So the gauge is the needle's diameter. Ooh. The gauge is the needle's diameter. It's the and the length is the needle length. And also when you're using needles, it's up to you to decide which needle to use. Should you use the long needle, the short needle, the bigger bore, the smaller bore? It is your call, depending on the medication and the patient you will be injecting these to. So it's going to be a little tricky for you guys at first because you're not familiar with it yet. But as you do more and more shots, IV pushes, subcutaneous shots from insulin to heparin, you will get to know your needle. This is why the clinicals is an important part of this road. Choosing a needle. There's different gauge to inside diameter. If you look at these needles here, from the left to the right is the different sizes. The bigger the bore, the more it's painful it is because it's bigger. And the smaller it is on the right, the less painful it is. It also depends on the medications. If I have, I'm gonna say a medication, Ativan, if you're not familiar with this medication, IV form, it's oily. So it's very thick, almost like cooking oil consistency. So imagine injecting something like that using the very fine needle. I'm gonna have a hard time pushing it through the needle. So I'm gonna need a bigger bore for that. For needle sizing, the bigger the number, the bigger the number, the smaller the needle. And there's also this thing that you need to know called bevel. This is the tip of the needle, the angle of the tip. If you notice when you received your shot, I don't know if you were paying attention to it, the person giving you the shot, the person drawing blood from you, giving you an IV when you were hospitalized, or your mom, whoever it was, they don't tell you bevels up. It's just an understanding that if you're going to insert something into the patient, the bevel must be up, because that's where that's the angle of the needle. So if I'm drawing blood from you, I can get better blood flow through this coming out of this needle because the bevel is up. And also the length. Remember I said it is up to you to decide which needle size and length you will be using. If I have a 2-month-old baby, there's no way I'm going to use a 2-inch needle for this patient. I'm going to use the shortest possible needle for this patient. Or then again, if I have let's say a 500-pound patient getting a sub-Q insulin, okay, I guess it doesn't matter. I can use any of the length, because I know when I get in the patient through the patient's skin, I'll be in the subcutaneous tissue. Let's calculate some liquid injections, which is going to be the test, pretty much. Calculating some drugs. Just like the previous system methods I showed you, the formula method, ratio and proportions, dimensional analysis, you can use any of these to calculate the medications. It's whatever you will, whatever you're comfortable with. They all come out to the same answer. I think for the next, maybe this session, I did examples using all of them, but I think starting next week, I'm just gonna focus on dimensional analysis because it's easy, and most of you guys, the Gen Zs, like this method. So not to discriminate for the people around my age, but we're gonna go with dimensional analysis. And solving liquid injection problems, use the same rule as for oral solids and liquids. Nothing changed. If you're solving for any type of medication, from pills to liquids to, well, drips are a different story. It's the same formula you see up there. And also, so next is the syringes. Let me give you a tour of the syringes and how to calculate medications using syringes. Because if you've seen the syringes, there's a bunch of lines. How do I know which line is which is what? It gets a little complicated, but it doesn't. So to calculate milliliters into this 3 ml syringe, carry out the arithmetic to the 100 and then round to the nearest 10th. So my 1.25 becomes, I should have put 1.26 to make it easier, becomes 1.3. So my 1.3 is going to be so much, where's my mouse? Why's my mouse disappearing? So much easier to find on this 3 ml syringe. There's another one. My 1.62 is now going to be 1.6 ml. It doesn't matter what this medication is. Yeah, it could be heparin. Actually, that's not a good example. It could be propofol, 1.6 ml. So it's easier to find 1.6 ml on my syringe instead of 1.62. And it's going to be right there. Let's put this in, let's do some drug calculations. See how this is gonna, yeah, let's do a drug calculation. Here's one. A patient is to receive promethazine, which is a nausea medication, 25 milligrams, Q6PRN, IV, parenteral. The medication is supplied 12.5 milligrams per ml. How many milliliters does the nurse need to drop on a syringe? This is a textbook test question. I'm probably going to have, I don't know, at least five questions like this, because you need to know how many, and you're drawing up medications to give to the patient, you need to know how to do that, how to calculate that, how to solve that. I'm going to solve it for you using the formula method and also the fractions method. Desired over half times 1 ml equals 2 ml. And here's my fraction method. 1 ml comes in 12.5, cross multiply X. There it is, 12.5 to 25 milligrams. You know I gotta isolate the X for that. Simple math so far, simple math. For some of you, it may not be simple math, but here's two solutions to this problem. So X equals 25 over 12 and a half is 2 ml. Let's try it the dimensional analysis way, which is the, well, I think it's easy way. So I desire 25 milligrams. It comes in 1 ml over per 12.5 milligrams. Cross off my milligrams to my math there, 25 over 12 and a half is 2 ml. So for me to give this medication to the patient, I need to draw up 2 mLs of the Phenergan for my patient. Next. Here's another one. Solucortef, which is a steroid. Available it comes in 100 milligrams over 2 ml. How many milliliters does a nurse need to draw up in a syringe? Here it is. Desired over have. I desire 50 milligrams. I have 100 milligrams, and it comes in 2 ml. Work it out, work it out. When we do the testing, I'm going to give you a sheet of paper. Give me the solution. I need to see your solution. So if there's any questions on your answer, we can backtrack to see. Maybe you just put the decimal wrong. Maybe you did some minor, you divided instead of multiplied. So here's my fraction method, ratio and proportion. The medication comes in 2 ml per 100. I don't know, but I need 50 milligrams. So X equals 100 milligrams, cross multiplication, 100 milligrams. Isolate my X. And there's my answer, 1 ml. Okay. My dimensional analysis, people, which we're going to start doing it this way next week. I need 50 milligrams. This medication comes in 2 ml per 100 milligrams. You can see it on the question up top. Do some math, cross off my milligrams. 100 over 100 equals 1 ml. It seems simple, but sometimes students get mixed up with putting where the numbers where they need to be. So practice, practice, practice. So I'm going to have a lot of examples here for you so you can go back and trace. The order reads, let me give you a little secret on these test questions. Oh, I'm going to escalate the questions here a little bit, but the order reads cyanocobalamin. I don't even know what this medication is. 300 milligrams, 300 mics daily for 5 days. Oh, this is not then 200 microgram per month IM. There's some bits and parts and pieces of this question that is not, that's irrelevant. It's like the route. For this question, the route is irrelevant. For this question, the medication is irrelevant. Cyanocobalamin, it could be dopamine, it could be aspirin, it could be whatever medication, vancomycin, it doesn't matter what the medications is. The question is asking you, how many milliliters contain the daily dose? And let's do that. And part 2 of that is how many milliliters contain the monthly dose? So I am going to calculate desired over half times supply For my daily dose, I desire 300 mics. I have 1,000 mics in 1 ml. So there's my daily dose, 0.3 ml. The second part of the question, what is my monthly dose? I'm going to use the ratio and proportions for this one. Cross multiplication, X 1,000 mics equals cross multiply 200 mics per ml. Standard rule of, I forgot the ml, standard rule of algebra, isolate the X, and which will give me 0.2 ml. I forgot to carry out the ml. So for this question, I need 0.3 ml for my daily dose and then 0.2 ml for my weekly dose or monthly dose. I think I also calculated this using dimensional analysis. And this is how what it's gonna look like for you people. 300, I need 300 mics. It comes in 1 ml per 1,000 mics. Yeah, cross off the mics, which is gonna net me 0.3 ml for the daily dose. Let's do the monthly dose. I need 200 mics. Set it up times, it still comes in 1 ml per 1,000 mics. Cross off my mics, which will give me 0.2 ml. So like I said, doesn't matter which method you use. I think dimensional analysis is better for most people. I like fractions myself, but there it is. So now let's talk about reconstituting powdered medication. Sometimes when you get a medicine, I should have put a picture up here, it comes in a powder form. And this is not how you're going to give it to the patient. You have to reconstitute this powdered medication with some fluids. It could be normal saline, it could be sterile water, whatever the liquid is, the instructions, they will give you instructions on how to dilute it, reconstitute it. It's going to be on the label of the vial itself. It's going to come in a packet. You can also look at your nursing drug books and other reliable websites, but you don't need to do, many moons ago when I went to nursing school, we had to carry nursing drug books because we kind of didn't have the iPhones back then. So I just dated myself. But now we have EMR, just like this. This is Jennifer. She's one of my graduating students. I told her, Jennifer, post for a picture, pretend you're doing something. But what she's actually doing is she is looking up the dilute reconstitution instructions for the medication she's about to give. It's on the Cerner, it's on the computer. It will specifically tell you, mix this medication with 10 cc's of normal saline. Maybe that was Protonic, normal saline, or mix this medication with 50 cc's of sterile water. Whatever the instruction is, it's right there on the computer, on the EMR. And most places are on EMR. They have to be. I think nursing homes may be the only ones. And here's a couple examples of reconstitution instructions. This is kind of small, but if you look on the left part here, it says, if you want to give 1 gram, dilute it with this much, with this much. Next. Here's another one for, I don't know which medication this is. Oops. I don't know which medication it was, but why am I having technical difficulties? But it's right here in the middle. It's telling me that for these medications, reconstitute with 2 ml of sterile water for injection. So this is an insert for the medication, which you will get when you get the medication from pharmacy. Next, that's reconstitution. Next, sometimes a drug is also going to come in a when supply is the ratio. Sometimes sometimes it's going to say you have this medication, it's 1 by 1,000. What does that mean? One per 1,000? It doesn't make any sense. But for your purposes, it's 1 per 1,000 is 1 milligram per ml. So if I have this medication, epinephrine, I need to give my patient, let's say 2 milligrams of this 1 per 1,000 epinephrine. It's kind of hard to do that calculation with using the ratio. But if you look to the right of it, it comes in, the equivalent is 1 milligram per ml. So now it's going to be much easier for you to do the calculation using the 1 milligram per ml instead of the 1 per 1,000. Okay, remember this. You're going to see this. This is maybe one of my questions for the test. And I said I'm going to take you on a Back to the Future here because I'm going to give you a sample of a test question that we give the graduating students. This is one of the most commonly missed questions and for them. So here's a little preview. Hydromorphone 2 milligrams IV now has been prescribed for a patient who is experiencing severe pain. 10 out of 10. Oh, that's bad. The dosage available is hydromorphone or Dilaudid 1 milligram per ml. Here's the tricky part. That's not really a tricky part. That's part of the medication instruction. The insert reads, dilute the medication, the Dilaudid, with an equal amount of normal saline solution and administer the medication via IV push no faster than 1 milligram per minute. How many milliliters would the nurse need to administer per minute? See how it kind of gets technical? First, you need to find out your new concentration, then you have to dilute it, and then you have to figure out how much of this, how many mLs can I give my patient per minute? Actually, Jean, this is for you. Take a picture. Too late, it's gone. I'm not going to solve it. Then I will be giving Jean the answer for your next semester. So here's a reconstitution question. The doctor orders penicillin, 500,000 units, and the vial of the powder is labeled 500 units. It comes in a powder form. The direction says, add 5 ml diluent. It didn't specify, it could be normal saline or sterile water, to provide 1 million units per ml. So the question is, how many mLs does the nurse need to draw up in a syringe? And also, here's another tip when you're taking these types of exam, look at the question first. I would look at this, I would read this backwards. How many mLs does the nurse need to draw up in a syringe? Okay, after I read that third line, then I'm gonna go up. The doctor orders blah, 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 penicillin. Because I need to know what I'm looking for before I get all these details in my brain. So let's solve it. Ordered is 500,000 units. In the vial is 5 million units. The instruction says dilute this powder vial of 5,000 units with 5 ml of, let's say, normal saline. So now after I dilute this medication, I'm going to have a solution of 5 million units per 5 mLs. Okay. So how much is that per ml? So I'm going to have 1 million units per ml. All right, now I can solve the problem. I still need 500 units for my patient. How many mLs should I give my patient? So now that I have 500 units, that's my desired. Over half, I have 1 million units times 1 ml. It's the supply. It comes in 1 ml after I reconstitute it. So I'm going to have 0.5 times 1 ml. So now I need to draw up 0.5 ml for my patient. Let me do that the ratio and proportion way. The medication now, after I dilute it, is going to come in 1 ml per 1 million units. I don't know how many mLs I'm going to give my patient, but I know I need 500 units, 500,000 units. Cross multiplication, algebra rules, x 1 million units times cross multiply the other side, 500,000 units. I should probably write faster when I do this. And now isolate my x, it will give me the same answer at 0.5 ml. And I keep telling you guys this, doesn't matter how you do it, just need to get to the right answer. And you can do it A, B, C, D, I'm sure there's other ways to do it. As long as you get to the 0.5 ml, I'm good with that. Some of you might even use, let's do the ratio and proportion, dimensional analysis way. I need 500,000 units. It comes with 1 ml per 1 million units. There's the math. Cross out my units. This math might be too simple for some of you guys, but work it out. Keep working on it. Practice. Here's another example. The doctor's orders, is this the same one? Oh no, this is a different one. The doctor's orders piperacillin, which is an antibiotic, 600 milligram IM. I'm missing a period there. The vial of powder is labeled 4 grams. The direction says add 10 ml sterile water to yield 1 gram per 2.5 ml. Calculate the amount to administer. At the end of the day, I just want you to tell me how much are you going to give the patient. So you need to learn how to calculate this now, because when we get to the clinical setting, hopefully you're with me. I'm going to have you calculate these things. How much are you going to give my patient? And so you can't tell me, I don't know how to do that. Then I will just remind you, yes, you do. We did that. You did that. So order is 600 milligrams. The vial is 4 grams or 4,000 milligrams. I did some conversion there because I needed to work in milligrams, not grams. Dilute with 10 ml. So now my 4,000 milligrams medication in 10 ml will give me, I will now have 600 milligram per 1 ml. Okay. But my instruction says I need 2.5 ml. Okay, So now let's calculate this. 600 milligrams and 100 milligrams. I'm using formula. Desired over half times supply. 6 times 2.5. So I will be giving this patient 1.5 ml of this medication. Okay, so if you're coming at me, if you're going to your patient saying, okay, Mr. Jones, here's your medication. I have 1.5 of this piperacillin for you. And there it is. Let's do it the fraction ratio and proportions way with the fractions. We have 2.5 ml per 1,000 milligrams. And I don't know how many mLs over 600 milligrams. Cross multiplication will give us same answer, 1.5 ml. I think my computer got stuck there. My iPad got stuck. Oh. So far, simple math, just moving things around, multiplication, addition, nothing too technical. And the answer is 1.5 ml. I'm thinking dimensional analysis way. I need 600 milligrams. What do I have? After I did all the calculations, we are going to have 2.5 ml and 1,000 milligrams cross 600 times 2.5 is 1,500 over 1,000 equals 1.5. Whatever way you do it, it's going to come to the same answer. So now let's talk about, we're done with that. Let's talk about oral liquid medications. You're going to be administering some of this. What is this, cough syrup or something? One thing you need to know about the liquid medications is this thing called the meniscus. It's the bottom part of the liquid when it's, oh, my cup is uneven, but it's the bottom part of the liquid. And when you're measuring liquid in a cup, cylinder, or anything, that is the line you're looking at, the bottom part of that, let's say scoop. That is called the meniscus. Sometimes liquid will tend to pop up like that. I don't want the top. I want the bottom part. I don't want the sides. I want the bottom part. This is going to apply in measuring cups, cylinders. Here's, what is this? In a syringe, that is where I want. So in this case, whatever this medication is, it's going to be 2.4, well, 2.35, I think, because I picked a bad picture here. So now let's talk about 1 ml syringes. These are one of the tiniest syringes you're going to see in the hospital. You might see some 0.5 ml syringes. For the most part, we use this for insulin, heparin, TB. Those are the ones I can think of off the top of my head. But it is, we use this 1 ml syringe because it's precision. I can get to the, if I want 0.8 of a medication, I can grab this syringe and I can get exactly 0.8 medication. If I use a 5 cc syringe trying to get a 0.8 medication in there, it's very, very difficult. The larger the needle, the larger the syringe, the more difficult it is to control, especially if you're in the, to measure, especially once you get to the point to under 1 of medication. To calculate milliliters when you're using 1 ml syringe, carry out the arithmetic to the thousands place, and then round off the answer to the nearest hundreds. So my 0.978 will become 0.98 ml, which is going to be so much easier to do using a 1 ml needle syringe. Next is the insulin syringe. You're going to be very familiar with this. I think some of you guys are diabetics in the class. I've noticed some, I forgot what they're called, the little patches on the shoulder when I was walking around last time. So these are your insulin syringes, and they're only used to administer insulin. That's it, nothing else. This is not measured in ml, liter, or anything like that. The units of measurement for these insulin syringes are strictly in units. They're usually coated with orange caps, but I tried looking it up. I'm not sure if it's universal. I'm almost positive it is, but don't quote me on that. These are only used for insulin in units. And do not confuse this with any other 1 ml syringe. Maybe you need to give somebody a PPD or heparin injection. This is not it. That is a med error waiting to happen. Insulin injections. I was said here, you need to know the onset, peak, duration of different types of insulin. And then I thought, not really. If you're in my pharm class next semester, then you need to know the onset, peak, and duration, but not for this. So this is more of an introduction. Also, mixing insulin, rapid, intermediate insulin. No, because this is something I talk about in the pharmacology class. So I don't even know why I threw this in here. Let's skip through these. I guess this is like a down payment for next semester. Like this. You need to know that for next semester. What you need to know, nope, skip that. Mixing, there's yeah, even though we don't mix anymore, we'll skip this. We'll talk about this next semester in your Pharm 1 or 2. What you need to know is this. The insulin sliding scale. You're going to have patients who has, this is a sliding scale you see on the screen. There's a low dose, moderate dose, and a high dose. This is how it works. If I check my blood sugar and it says 245, and I was prescribed the low dose insulin sliding scale, I'm going to go to the low dose of the section of this, and it's going to tell me how much insulin I need to give my patient. So I check my blood sugar, poop, it's 245, and based on my low dose insulin sliding scale, my patient is to receive 6 units. See it right there, 6 units. So I'm going to draw up 6 units, boom, boom. Here you go, Mrs. Jones. Here's your 6 units. Thanks, have a good day. If Mrs. Jones is on a high dose insulin sliding scale, maybe her blood sugars are out of whack and we're trying to control it, whatever disease process she has. And her blood sugar is, say, at 200. I'm going to go to right here, high dose insulin sliding scale for Mrs. Jones, who has a blood sugar of 200. So I will be giving her 12 units of insulin. And what if Mrs. Jones insulin is 145? I don't, regardless, at least let's say she's on a low dose, then I don't have to give her any insulin, because it says between 70 to 130, give 0, no insulin. What if Mrs. Jones' blood sugar says 25? That's too low. What if it says 65? Then I'm gonna have to go up here. It says initiate hypoglycemia protocol. Every facility has a hypoglycemia protocol, depending on your patient. If they're awake and alert and they can swallow, you give them some, I think some sugar, orange juice or something like that. And or if they're not, there's some B50 that will cover when you get to your farm 2. It's an injection type of medication. It's pretty much sugar water that you're injecting into the patient to get their blood sugar up almost instantly. Don't quote me on the sugar water. It's sterile sugar water. So here's a question. Let's see who can get this. Type the answer for this. Whoa, type the answer for this in the text box. The order. Come on. The order says regular insulin. The order says, come on. Maybe I should use my arrow. There. The order says regular insulin, 20 units, and NPH humulin insulin every day subcutaneously. So regular insulin is your fast acting. Human NPH is your slow acting. So we're going to combine these two. The supply, regular humulin insulin, 100 units per ml, and NPH humulin insulin, 100 units per ml. Patient is 4 hours post-op and had 2 cups of ice and 2 orange juice in PACU with a slight nausea from anesthesia. What will be the total units in the syringe? Boom. Give me a number. Type it in the chat box. What's the number? You can yell it out. How much insulin should I give my patient? Give me something. It sounds technical. Anything? Anybody? 32. Jorge's at 32. Jorge, Sarah, Katrina. For 32. It seems like the consensus is 32. And that is the correct answer. It's kind of like a trick question, but it's not. My point with this question is sometimes there's a lot of information on the question that is irrelevant. But if you look at my question here, it says I have regular insulin 20 and NPH 12. So I'm going to need a total insulin of 32. There's my supply. 100 units per ml. I don't care if it comes in 5 million units per 5,000 mLs of a bag, or it comes in a gallon of a milk jug. And next part of the question is, patient is 4 hours post-op, 2 cups of coffee. Completely irrelevant to the question. So that's why I'm telling you guys, read the question first so you do not get sucked in to the storyline, because that's a typical question for especially as you get to the next levels of nursing school. They're gonna suck you in with the storyline. My 29-year-old, my 70-year-old COPD patient, this is what's happening, and they need breathing treatment, but they just want to know how many insulin I should give my patient. So takeaway for that is read the question first. Let's do another problem here. I think I need battery for my mouse. How about this one? The order says heparin. We're back to calculating dosages. Heparin, I need heparin 2,500 units sub-Q. Available is, I don't know, it says look in the box. All right, well, there's the box. How many ml should the nurse draw up in a syringe? And what syringe will be most appropriate to use? Okay, what did the box says? The box says this medication comes in 10,000 units per ml. All right, now I have something to work with. Let's solve this thing. So I need 2,500 units. It's really not working. Oh, all right. So I need 2,500 units. And what I have on hand is, it comes in a desired, this is desired over half, a desired 2,500 units. And it comes in, I have 10,000 units, and it's in a supply of 1 ml. A little bit of division there, times 1, it will give me 0.25 ml. So I need to draw up 0.25 ml for my patient. Let's do it fraction way, ratio and proportions. The medication comes in 1 ml per 10,000 units. That's what it says in the box. And I need 2,500 units. Basic math again, cross multiplication, isolate the X, which will give me 0.25 ml. So thank you very much. You solve how much mLs I will give the patient. But the next question is, what syringe will be most appropriate for use for this patient? Since we're talking about 0.25 mLs, that's like 4 drops of something. I will be using the smallest syringe available, which is the 1 ml syringe. I think I did a dimensional analysis here. Same. I need 2,500 units, and it comes in 1 ml. It says in the box, and 10,000 units. I'm repeating myself, using a different way of using it. So you can, when you're studying for the test and you're kind of get stuck on something, you can refer back to this. One more. Let's do it dimensional analysis way. So I have furosemide, Lasix, 20 milligrams, IV ones. How many mLs should the nurse draw in a syringe? I don't even know how much is in the medication. What the box says, it comes 10 milligrams per ml. So here I am, so calculating it dimensional analysis way, 20, I need 20 milligrams, and it comes in 1 ml times over 10 milligrams. There's my simple math. So I need 2 mLs for this patient, to draw up 2 mLs for this medication. That's all I have for today. Practice these questions. For the most part, the test is a lot of this because I'm still building up. I'm still setting you up. We're not done yet. This is not the finish line on how to calculate medication. We still have weight-based dosaging. We still have drips. We still have weight-based and then drips and then titration stuff. I'm still building up. So, but for now, practice these equations, work with Jean. I think she has some good examples. If you're stuck on something, call Jean, don't call me. Actually, I'm kidding. You can call me. If you text me, I will, yes, June, same room. I would highly recommend you guys show up early because so you can set up the Wi-Fi. I guess we had some issues with it last time. Same system, bring your laptops. I will give you a paper. Oh, and those calculators, I have to get them. And what else? Yeah, Jean has some good examples, or you can refer to these slides. If there's some questions, you can call me, text me. But Canvas, use the Canvas as a last resort. Some of you guys ask me questions and now I feel bad because it's like a week later and now I'm seeing it. And by the time I respond to it, it's too late because either we covered it, I've talked about it. And so I think I've gotten some questions on how to prepare for this exam right here. I said it already. This is, for the most part, this is the exam. How to calculate drugs from pills to liquid to IV. This is because that's where we are now. Questions? If not, hang out with Jean. She will walk you through it. Maybe Jean has an easier way than dimensional analysis. She's the smart cookie. It's taken her about 8 years to go through nursing school now, so she knows her stuff. All right, guys, if not, I will see you next week.
Thank you, Professor.
All right, see ya. You're welcome. Bye. So no cal can be wait. No cal. There is. Oh, some people left. There is. Which is you already have that. So it's nothing special. I didn't add anything. All that other stuff comes next test. Welcome. All right, that's it. Check it out. Where's my exit? Oh, I gotta stop recording first. Stop. Where's my recording?